In UK, you're not alone by any means. You get whatever you need in the health system, from prevention, vaccination, management of simple and complicated cases. The basic needs are just covered by the government. If you don't have money, you can have food, whatever the patient needs.
Everybody in Sudan is waiting to go out of Sudan. Bear with it, finish your training and go.
My name is Muna and I'm from Sudan. And Sudan has a special situation because we have been under war for some time, for years and years, and people fighting against each other. One of the poorest countries in the world. The basic needs, eating, schooling, health, everything. We lack all that in Sudan, actually. And even if you go to rural areas, you can find only one hospital with one doctor running the whole, covering like population of thousands of people. You have to fight just to eat. You have to pay for everything in Sudan, nothing for free. To buy like the cannulas, the IV fluids, the doctors just take from their own pockets, because you can't, stand watching someone dying in front of you because he hasn't got the money to buy cannula or fluids or whatever. It's the worst situation ever. Between 10 to 15 children dying every day, summertime, because of malnutrition and dehydration. Many people dying just of preventable diseases. Whilst I was working in the general medicine of Khartoum Teaching Hospital, one of the security people hit one of the doctors in the middle of the night whilst he was doing his jobs. And then they promised us they are going to live in. But after a few months, they came back and they were doing the same stuff.
Every morning, doctors are shipped to work abroad because of the bad condition in Sudan, the bad treatment, the low salaries. My name is Wegdan Mohammed, and I currently work for South London and Moseley Hospital as one of their clinical pharmacists. I started studying medicine in Sudan, and a lot of my classmates are currently working as doctors in the UK because there's no place for them in Sudan. And the silly government, they train them, they spend money on them, and then they let them go.
People are just looking for a better status. Of course, there is individual reasons, but the general reasons are mainly the political things, with the deficiency of everything related to medicine in Sudan, like the training, supervision, the infrastructure, availability of the medications, investigations. And so you don't feel like you are doing much to help the patients. Some doctors are even working without any salaries, and the salaries are very small, as they don't even cover their living expenses. This is my husband, by the way. For me, the main reason was political reasons. For example, I have been arrested a couple of times because I was not wearing hijab. We are governed by this Islamic party. It's related to every corrupted stuff in the world. So everyone just wants to leave Sudan. Of course, it's going to affect the services provided by the health system to the general populations, because you're getting most of the highly qualified doctors leaving Sudan, looking for best or better opportunities.
the teenagers now, this is the mentality. If you're not part of the current government working for them, then you are waiting to go out. There with it, finish your training and go, and then their life will start. In the coming few years, people will even realize more there's no way back to Sudan. Member of the government need to look after the healthcare professionals.
Doctors leaving, people are buying, just preventable. Money, if you give them some money, they will be able to feed their children, cover their living expenses. Give them education for free, reduces the security in terms of they are not going to contradict with our works or any personal issues. You work with the social people, work with the community, the council. We don't have that back home, of course. People must be happy. I'm lucky living in the UK.